March 2023, that's going to mark 3 years since health officials declared COVID-19 a pandemic. The CDC says the latest variant, XBB.1.5, is on the rise, but still makes up a minority of new infections across the country. Now, the threat of COVID is different than when it was first detected. However, it's still very much a part of our kind of daily lives. So today we're joined by Dr. Cynthia Snider, Infection Prevention Medical Director with Cone Health, and she's answering many questions about the current state of COVID-19, the latest variant, boosters, and of course, much more. We want to give you an opportunity to be able to ask your questions one-on-one with our expert, and you can text that question to us. The number is on your screen. It's 336-379-5775. Remember, your questions are anonymous, but you get your questions answered in real time. All right, Dr. Snider, right after the holidays, of course, we saw that spike in COVID-19 cases and hospitalizations. It's been a few weeks, so what do the numbers look like now?
They do look a little bit better. So I believe the statistics across the state as well as the U.S., we're starting to see cases trend down. And however, we do know that that proportion of cases that are being reported and tested out, that we're finding it's more likely to be the new Omicron subvariant called XBB.1.5.
Okay, gotcha. All right, so that is the newest one, which supposedly is more infectious.
Yes, it turns out that due to the mutations it has, it's able to bind to cells a little bit more effectively, and thus likely to be more contagious. What we do know that it's not any more severe than its predecessors, and then also we know that still that contagious period is the same. That a day or two before your symptoms onset, you can spread COVID to somebody else. It lasts about 5 days. You can still test positive, a week after your symptoms start. So the incubation period and the isolation period does not change.
Okay, so that is good to know. Now, is there a specific age group or demographic that has been testing positive or hospitalized more than others?
It's hard to say. We know at least those who are seeking testing through medical centers, we know that if somebody's symptomatic, they're at least in our health system, about 10% are testing positive, and of those cases, about a third of them end up having to be hospitalized. So it's usually people who are coming in happen to be older, they have multiple comorbidities, like heart disease, diabetes, lung disease, that make them more likely to get hospitalized. We do know that for somebody that's otherwise healthy or previously immunized and otherwise healthy, that the symptom onset will probably be not too bad, just like probably like similar to a bad cold or flu-like illness.
And of course, you're going to have people out there who are like, okay, well, I get it's more infectious, but the symptoms are still as mild. So can't we just kind of go on with everyday life this way?
Yeah, I know. I think, we're getting there, but we're not quite there. We know it's infectious. You don't want to spread it into like anybody's like grandparents, their parents, into the schools. So I am more of the frame of mind of like, if you're having any kind of respiratory symptoms, nasal congestion, don't always think it's due to allergies. It's important to get tested, and more importantly too, just to mask up.
Okay, so a lot of folks would be asking, how effective is the newest booster in preventing this latest strain?
So, more information is still to come. We know that there have been some preliminary studies that show that it is effective. It's still effective at preventing severe disease. And that's the whole aspect that we have to think about the vaccines in general. It's not going to be great at preventing the original illness, and what your hopes is that the vaccine boosts your immune system enough to make sure that you don't have such a severe disease that you require hospitalization or potentially needing intubation because of such a severe disease.
Okay, and so this person's already asking, how long do you have to wait to get a booster after you've had COVID?
So we recommend that, right now, if somebody has just had the vaccine, right, their primary series, they should wait 2 months to get the booster. In terms of somebody who's been having the illness, right, so you have natural immunity, it looks, I would say, you can still be safely protected with your immune system for about 3 months, and it makes sense to get boosted thereafter.
Okay, so 3 months after you've been sick and 2 months after you've had your first shot or your last booster.
That's right.
Okay. All right, I want to make sure. And so, if folks have been kind of putting off getting their next booster, they're like, well, I got one sometime last year. Why should they get it now?
Well, we know that your immunity, once you get the vaccine, that booster vaccine or that primary series, it doesn't last forever. We know it doesn't last a year. And so similar to the flu vaccine, it has the set amount of time of durability. And depending on your age, if you're older, it may not last as long as if your immune was stronger when you're a younger age. So if you can't really remember the last time you've had your booster, it's probably the right time to get one now.
It was interesting. We're talking about how Pfizer has 2 doses, 21 days apart for the actual shot. The Moderna had 2 doses. Of course, Johnson & Johnson had 1 dose. If people are just getting their vaccines.
So right now, if you were to choose between the different vaccines that are available for COVID, the one that's you would need, what we know is that 1 shot does not do enough. So any of the vaccines that are 2 or 3 dose series, those are the more effective doses.
Okay, that is good to know. Okay, and then so someone was asking about a K95 mask. She says, I wear a K95 N95 mask to work every day. When do I need to throw it away and get another one?
Back in the beginning, when there was such shortage of masks, there was numerous newspaper articles, news segments of how to protect your N95 and keep it, durable. And right now, I'm a fan of, if you can afford it, you should just get a new mask at the end of the day. Once you're finished with your day, and start fresh with a new mask the following day.
Okay. All right. We've got several text messages here. We're going to get those when we come back after the break. Make sure that you put in your text message. It's 336-379-5775. We'll be right back.